Hello, my name is Juan Limon, and I'll be doing my palpations video for the hip and pelvis. Now for our first two palpations, we'll be using the skeleton as our model. For our first one, the pubic symphysis, it will be located in the anterior inferior portion of the pubic area. And right here, there should be a cartilage that joins these two bones together, right here. Now typically, we are not using this or palpating this during an evaluation, but it's important to know just for pain reference. Now for our second one, the anterior inferior iliac spine, or the AIIS. First, we'll be locating the ASIS, which is found right here, and going medially and inferiorly about an inch, we can find the AIIS. To palpate this, usually we can instruct our patient to put their hands on their hips, and normally their index fingers will be on the ASIS, going just inferior and medially to find the AIIS. Now for our next palpations, it will be arm musculature. So we have our model sitting down, and for the sartorius, which is our first one, we'll instruct them to put their foot on their opposite knee, like so, and I will isolate the muscle by placing my hand on the medial thigh and instructing them to raise their knee towards the ceiling. So go ahead. And if you strum right across where you feel the isolation, there will be the sartorius right here, going from the ASIS all the way down to the medial distal tibia. For our next one, the rectus femoris, I will have my patient laying supine with her leg slightly flexed, like so. Now you place your index finger slightly above the patella and at the ASIS as before. Now if you just draw an imaginary line between these two structures, it would be the muscle right here, the rectus femoris, all along, right here. Now for our next group of muscles, which is known as the adductor group, it is the adductor magnus, brevis, and longus. So I have my patient have their knee slightly externally rotated. Now for the next portion, it'll be the adductor magnus first, because it is the most superficial muscle and it covers and fans over the next two, brevis and longus. Now they all attach at the pubic tubercle, known more superiorly, and they insert at the medial femur right here. So normally this portion will be the adductor magnus, which fans over the brevis, which is slightly above, and the longus, which is inferior to that, all along the medial aspect of the thigh. That's a palpations video for the hip and pelvis. Thank you.